Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hey there, Dr. Moya. How are you today?
I am great. Again, very excited for this episode of our podcast.
Yeah, we have a lot of questions about this topic, which is basically has to do with insurance. So there are some cases that you're able to do with insurance, very little. A big one being the tummy area. Can you talk to me more about that and what's all involved with getting insurance to help with paying for this?
Absolutely. That is a very important topic, and I certainly get a lot of questions about it. For us, at the end of the day, we always try to help our patients, and if we can save them some money, meaning getting part of a surgery covered, and I say part of, and I'll explain that, then we'll go for it. So basically, when it comes to body contouring after weight loss, there's only one area that an insurance company might look at, and that's going to be the tummy, basically the lower tummy. If a patient comes in and they have a moderate size or a large size lower abdominal overhang, and that's like a lower apron of their tummy, then that might be something that we can look into when it comes to insurance. But there's a lot of different components of that, and we can kind of go over that.
So how is that a covered benefit? What requirements make that a covered benefit for patients?
So the first thing patients would need to do is look into their insurance plan and see if it's actually a covered benefit, meaning they can actually call the insurance company and ask, do they cover an abdominal paniculectomy? That's actually the terminology. And there's a specific code for it because it goes by coding. Because of course you're talking to somebody on the other line, they probably know nothing about medical or anything. They're just answering the phones, and then they look up the specific code, and it's called a CPT code. And
what does that mean?
It's a procedural terminology code. It's the current procedural terminology code, and that code is 15830. Okay. It's been that code for years. That's
the specific code they need to check to see if it's covered for them.
Correct. So they could call their insurance plan and ask, hey, do you cover 15830? So the person on the other line will take a look at their insurance plan and say, well, yes, this is actually a covered benefit under your plan if you meet requirements.
Okay. And what are those requirements normally?
So if they get that, then that's great. Then the next thing will be to decide, do they meet the requirements? Unfortunately, there are insurance companies that don't cover it. And it's not insurance companies, it's insurance plans. So basically, most patients are going to come in because their insurance is from their employer. Depending on the type of plan the employer has purchased for the employees will determine if that's a covered benefit. So unfortunately, there are some that it's just not a covered benefit.
Right.
So that would be, unfortunately, that would be done at that point, unless they can switch insurance companies to one or insurance plan to one that is a covered benefit. But a lot of times that might not be an option if they're employed.
Right.
So, all right. So if it is a covered benefit, the next thing that they'll have to look at is, do they meet insurance requirements? And that has multiple components. So number one, what they're looking for is a medical issue with the skin. That's it. That's number one. That is the most important thing that they're looking at. They're not looking at, well, yeah, I have this overhanging skin and it, and it looks ugly. Okay. Or it's really bothering me. It doesn't fit into my clothes. They don't care about that. Oh, I have this, big amount of loose skin on my tummy. It's an overhanging skin, and it just makes me feel self-conscious. To us, that's very important. To an insurance company, they just don't care.
Right.
So that's not what they're looking for. They're looking for a problem with the skin. And basically what that is some type of rash under the skin fold. So it's because it's a dependent area, meaning the overhang kind of closes off that crease. It's hard to keep it dry, and it leads to issues, is basically what happens. So for patients, number one, it has to cause a rash. That kind of rash, it can vary. Some patients, it's just red and raw. For some patients, they can get a breakout. For some patients, they can get a fungal infection. And for some patients, they can even get a bacterial infection. So those are the kind of things they're looking at. So from there, they're just not going to take the patient's word for it, unfortunately. They're going to want to see documentation from another doctor. And that's not necessarily the plastic surgeon, or if they've had bariatric surgeon, it's not necessarily their bariatric surgeon. They want to see it from a primary care physician or a dermatologist. So that is a very important component of proving that the patient has a medical issue with the overhanging skin.
Right.
Okay. I would say that that's number one. That's the most important. If you have that, then probably the rest of their criteria doesn't matter. But we're going to go over some more.
Okay.
For some patients who don't necessarily have that, they can say, well, I take care of it with over-the-counter medications. We still can get that approved if they meet other requirements. So one of the other requirements that insurance companies look at least the majority of them, if you've lost weight, how much have you lost?
Okay.
Okay. And in particular, have you lost 100 pounds or more?
Okay.
Have you lost 40% of your body weight? And I'm just giving you examples just from specific insurance companies that I have dealt with, and I just keep adding it to my list of things that I kind of share with patients. So that's one. Number two is a lot of times they look at the photos, because we actually have to take photos of the patients that come in, because insurance will not even start their paperwork if they don't have photos of the overhanging skin.
Okay.
So we'll take photos, and the reason they do that is because they want to make sure that apron is big enough to say, okay, that probably is going to cause you some symptoms.
Now, what does that mean, big enough?
Big enough means that it overhangs low enough. And for insurance, it means it covers the top third of their thigh. Not a small little overhang that, for us would really be a tummy tuck. For insurance companies, and that's the reason they're doing it, is they don't want to pay for a tummy tuck.
Right.
So it needs to cover at least the top 1/3 of the thigh.
When you're standing.
When you're standing, correct.
Right.
So we would take pictures of front view and side view for them to prove that to the insurance company. With that, basically, and the patient actually telling us that they have issues and they're doing over-the-counter medications, might be enough that we can petition the insurance company without the documentation.
Okay.
Okay? If they don't meet any of those, or they're lacking one of those, then the documentation is a must.
Right.
Okay?
Okay.
So that's kind of how we look at it for the criteria.
What about the insurance participation with a hospital?
Great. So another thing for us here at Lewisburg Plastic Surgery is if an insurance plan offers it as a covered benefit, and then the patient meets the requirement, where do we do the surgery? Well, we do not do an insurance-covered procedure that requires general anesthesia in our ambulatory surgery center.
Okay.
We don't have that set up with anesthesia. That's basically why. So we need to actually go to the hospital to do that. And basically, now we have to look at, does the hospital accept the patient's insurance plan? Meaning, is the patient's insurance plan in network with the hospital? Otherwise, it doesn't make sense, because then it's going to cost a lot more.
Right.
Okay, so that's what we need to look at for us to actually proceed with the that portion of the procedure, the paniculectomy covered by insurance. We have to make sure that our hospital, which is Evangelical Community Hospital, is in network with their insurance plan.
Okay. So when we're talking about insurance is going to approve their paniculectomy and that's being covered by the insurance, what does that mean? Is insurance paying for 100% of their cosmetic surgery?
Great question, because what the insurance is covering is only removal of the apron below the belly button. Basically, you're really left with no contouring. And in some patients, it looks worse than when you started. So that's something we just don't offer. And I usually counsel patients, because sometimes patients can get that covered by their bariatric surgeon, because, the bariatric surgeon is trying to help them out. And so they'll take that out, take that piece of skin away, and maybe do a little bit of contouring, but not a lot, because they're just really not trained into that. It's a great idea. It helps the patients get rid of the symptoms, but it may not leave them with good body contouring. So for us, we do not do that alone for that reason. It's not body contouring. And we have different options where we can bundle that procedure into a body contouring surgery. Okay? And we can do that because we've worked that out with our community hospital so that we can bundle that in and help the patient save money at the end of the day. Usually when we do what we call a split bill, meaning there's a part that's covered on insurance and there's another part that's a cosmetic part. But that's something that I had to work out with the hospital directly so that we can make this possible.
On average, how much can a patient expect to save by getting this approved and bundling it in?
Another great question. Basically, if we can get it bundled into a body contouring procedure and the patient is in network with the hospital and in network with us, because we do accept certain insurance carriers also, they could save upwards of maybe $5,000 to $6,000.
Okay.
That's a lot of money.
And what's the low end of
the low end might be, for instance, if somebody's coming from out of state, yet our community hospital accept their insurance, maybe they have a higher deductible, maybe they have a higher co-insurance payment, maybe they're saving $1,500 or so.
Okay.
But it's still $1,500.
Exactly.
So I would say that why not do it? So that would be always my encouragement, as long as we feel that they meet the requirement physically.
Right.
I think at the end of the day, it makes sense that we try.
So you keep mentioning bundling the paniculectomy with body contouring procedures. What exactly can you bundle that with?
Another great question. So basically, we don't bundle it with every abdominal contouring procedure. Basically, we do not bundle it with a tummy tuck because it's kind of hard to separate the two out. Basically, a lot of times insurance companies will say, you're just doing a tummy tuck. But if the patient is willing to have an up and down incision, so basically you're doing a cinching procedure, a lot easier for us to try to get that approved and a lot easier for us to split that out. So basically I do bundling with a fleur-de-lis tummy tuck or corset body lift.
Okay.
Is basically what we would do as an option if we can get insurance to cover the overhanging pannus removal.
Okay. And then the patient would just be responsible for what part of that then? So
basically the total cost will come down to what is the patient's deductible, co-insurance on the paniculectomy portion. And then there's a small charge that the hospital has after that. And then we split it up into the cosmetic portion, which is where they end up saving the money for the overall procedure.
Okay.
Because basically what happens is the way we have it worked out is the first few hours of the surgery for the paniculectomy is covered by insurance. And that's the greatest cost in the hospital, in the operating room, is opening the room up, all these charges that go into that. And that's why we can end up saving them some money if the hospital is willing to work with the practice, which we have set up again.
Right. So let's just say a patient has previously already had a paniculectomy. What can they expect coming forward and wanting more body contouring, and can they do that again? Is there any chance of them bundling anything?
That's a great question. Once the lower apron is gone. They do not cover an upper abdominal apron because there's some patients who can have multiple folds.
Right.
Basically, the coding is very specific. It's actually called an infraumbilical abdominal paniculectomy. What all that means is it means that your abdominal apron is below your belly button. And again, they have those wording very particular because they don't want to pay for anything else.
Right.
So if a patient still comes in and they still have loose skin of the upper abdomen, or loose skin of their lower chest, which is part of the waistline, there's nothing I can do to petition the insurance company to help us.
So that makes me think of other areas that patients have come in with concerns of rashes, if they have folds around their knees, arm folds. They want that area covered by insurance because they truly have rashes and irritation from those skin folds. But is that covered? Another
great question. And unfortunately, the answer is no. And the reason why, there is no CPT code for it. Again, remember, people who are answering the calls, doing all this, they come up with these codes that are covered, very specific, and there is no code. Now, I have had patients say, well, I went somewhere and they said that they would cover this. Basically, under the arm, some patients can have like an infection. It's called hidradenitis suppurativa. Different. I'm not going to get into what that means, but it's basically it's not necessarily due to weight loss. It has to do with other areas of the skin that can cause a problem, and that can be covered by removing it, which can also include removing the skin. But then it's usually a reconstruction that's required.
Okay.
And that we don't offer that as a code because it's not what we're doing.
Right.
I've had other patients ask me that because they were like, well, this so-and-so said that I could have my thighs covered or my arms covered. And the answer is going to be no, because that's not something we do, and it's not body contouring, and it's actually a different medical issue.
Right. Like even if their primary care doctor said, yes, this patient has documented rashes in these folds, I recommend that this skin be removed. That's okay that he's recommending it, but it's not like the insurance is going to pay for it.
That is
right?
correct, because at the end, then I would have to do a reconstructive procedure, which is not body contouring.
Mm-hmm.
Basically, you're making incisions in areas to move skin around, basically,
mm-hmm.
Or even a skin graft
mm-hmm.
is another treatment to cover the area of the skin that was removed.
Mm-hmm.
That is not what we do when it comes to body contouring after weight loss. So It's unfortunately something that we have to explain to patients that that's not covered, and it would be something that would have to be done at another hospital and another practice where they actually do the reconstructive component, but it's not body contouring.
Mm-hmm. What about these patients who take really good care of their skin, don't have any documentation of rashes, irritation from their doctor or dermatology? What can you do to help them maximize their chance of getting insurance coverage? Like, what do you recommend?
So a lot of times, unfortunately, patients, they take such good care of it that they're actually getting dinged for it mm-hmm. because they could have skin that's hanging down to their mid-thigh. Mm-hmm. They lost 100 pounds, 200 pounds of weight. They meet all the criteria, but because they're so good at taking care of it every day, wearing the right clothing, putting antiperspirant, let's say, mm-hmm. underneath there. And they do all these things every day, constantly. Because of that, there's no rash.
Right.
Then I would counsel that patient, and why are they doing it? Because it's embarrassing to them. Mm-hmm. They don't want to have all that, right? So unfortunately, now they're getting discounted because of it. So I would say that if they want to have the insurance help them, once they figure it out, they should first call the insurance company, make sure they go through all these processes to make sure that the insurance company is a covered benefit, make sure that if they're thinking going to a specific place that the hospital is in network. Then I would recommend they make an appointment with their doctor and don't take care of it for a few days before they show
mm-hmm.
up. And doctors are here to help our patients.
Right.
And what they need to tell their doctor is, listen, I lost all this weight. You can see this big overhanging apron. I'm kind of embarrassed, about even talking about this, but I want to see if I can get my insurance to help me. Can you please take a look? It's really rad and rashy under there. Mm-hmm. The doctor actually has to not just write down what the patient is saying, they actually have to evaluate it. Mm-hmm. So that's a very important part, because I've had patients say, I have documentation from my doctor. I went over there, and basically the doctor just said, patient came in and complained about this, and I just prescribed that. But there's no physical exam.
Gotcha.
So the physical exam has to be documented in the chart, mm-hmm. and then the physician has to prescribe something.
Okay.
Basically, antifungal cream mm-hmm. or whatnot. But that is what I would tell patients in preparation. If you feel that you are somebody that deserves help, then that is the best way to prepare for your plastic surgery consultation, so that we can get that together for the patient and submit it to their insurance.
One more quick question. Some of these patients who have not quite lost all their weight still have a pretty good sized hanging apron. Do you recommend that they continue to lose their weight before they do anything as far as a paniculectomy or body contouring if they have all these symptoms? Like what's a good rule of thumb as far as that goes?
Absolutely. That comes down to the criteria, like what we talked about in the previous episode about body mass index, mm-hmm. How mobile is the skin. So basically now it comes down to, can we do a body contouring procedure? Mm-hmm. And if we can't yet, because the skin isn't mobile enough, then it would be best that they're interested in the body contouring procedure, not just removing their pannus, mm-hmm. their overhang, mm-hmm. that they continue to lose weight so that they can get that bundled, because you only get that shot one time.
Right.
So that's something very important for patients. And I guess I've seen some patients where their overhang can be down to their knees. Mm-hmm. I mean, that's really hard to move around. So sometimes they have to just have that done.
Right.
But I would encourage patients that if you really want to bundle it because you want the best result, then the best thing to do is to just try to lose as much weight to your plateau. Mm-hmm. And then hopefully when we examine them, it's skin that's mobile and deflated enough mm-hmm. that we can actually move it around and cinch mm-hmm. it and be able to do a great procedure.
Mm-hmm. Okay. Well, that was a lot of great information. Thank you very much. I appreciate your time.
Oh, you're very welcome. It's one of those topics that we get a lot of questions mm-hmm. about. So hopefully this answers a lot of them.
Yes, absolutely. Thank you.
Thanks, Brittany.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the course of body lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.